Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about procedures for diagnosis of breast lumps, treatment, and answers to some questions people often ask about breast lumps. Procedures for diagnosis. If a person seeks medical advice for a breast lump, they may undergo one or more of the following tests: a physical examination, a mammogram, a breast ultrasound scan, a breast biopsy to rule out cancer, an MRI or CT scan to see if changes have occurred elsewhere in the body. Lumps in males. Males can also have breast lumps for similar reasons to females. In some cases, the lump may indicate male breast cancer. However, the chance of a lump being cancerous is lower in males. White men have a 100 times lower chance of having breast cancer than white females. For black males, however, the chance of having breast cancer is around 70 times lower than for black females. Overall, the risk of any male having breast cancer during their lifetime is around 1 in 833. Other reasons a male might have lumpy or enlarged breasts include gynecomastia, when the breast tissue enlarges due to a health condition or medication use, a cyst or fluid-filled lump, a lipoma, or fatty lump, adenoma, although this is less common in males than females, subareolar breast abscess, a rare infectious disease in males, adenoma, a benign tumor, also rare in males, breast fat necrosis, also rare in males. When to see a doctor. A person should see a doctor if they notice a lump in the breast or under the arm, nipple changes, such as inversion or discharge, puckering or dimpling in the skin. The United States Preventive Services Task Force recommends that females ask about breast screening from 50 years or earlier if they have concerns about their risk of developing breast cancer. Some people start from the age of 40 years because they have a family history of breast cancer or feel the benefits outweigh the risks. Treatment. A doctor should check any unexplained breast lumps, but not all lumps will need immediate treatment. For a cyst or a fibrous lump, a doctor may recommend monitoring the lump but not taking any further action. If there is an abscess, the doctor may lance and drain it with a fine needle and prescribe antibiotics. If cancer is present, treatment usually involves a combination of surgery, chemotherapy, radiation therapy, hormonal drug treatment. A doctor may also recommend testing for changes in the BRCA1 or BRCA2 genes. If this genetic change is present and breast cancer has occurred, preventive surgery may help prevent a recurrence. Other family members may also wish to seek additional screening. Here are some questions people often ask about breast lumps. What kind of lumps are normal in breasts? Breasts can become slightly larger just before menstruation, and they may feel lumpier. They also change during pregnancy and while breastfeeding. Some types of lumps, such as cysts, are very common. What kind of lumps should you worry about? One should see a doctor about any new or unusual breast changes, including lumps, or any changes they are concerned about. If pain or signs of infection occur, contact a doctor at once. What does a cancerous breast lump feel like? It is not always possible to know if a lump is cancerous or not by feeling it. Some people do not have a lump. They experience a thickening of breast tissue or other changes, such as an inverted nipple. Even if a lump is not cancerous, it may need treatment. Always seek advice for unexplained breast changes. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.